We want freedom! We want freedom!
After 2 years of some of the most divisive public health policies in Australia's history,
Leave now and you can go home.
the COVID walls are coming down fast, even as case numbers surge.
We need to move away now from counting the number of people who die from COVID-19 on any one day towards a concept known as excess deaths.
After a year of telling us to focus on deaths, not case numbers, it's a massive shift.
In terms of reporting in the media in a daily way, I think probably the time has come to move away from that because we're trying much more to live with COVID.
Restrictions are winding back further, the NT in Queensland joining South Australia and New South Wales in loosening restrictions on the unvaccinated. Queensland dropping rules that ban the unvaccinated from hospitality venues from next week.
In an industry that has over 100,000 open jobs, any employees that are able to return now that vaccine mandates are going away is super important.
But it's not the same set of rules for everyone yet.
To have cases going up and having rules come off, that doesn't make a lot of sense.
In terms of the remaining restrictions, we're obviously going to watch and see what happens with the numbers.
And businesses say the lack of consistency across the country is hurting.
That inconsistency is making it more and more difficult, let's say, to be able to move around Australia and to work and to understand what's going on at any given point in time.
Trying to keep track has become a real burden and I think can lead to important erosion of trust.
South Australia has dropped its vaccine mandates for teachers and public sector transport workers to combat staff shortages, with Victoria signalling mandates and home isolation rules could soon be ditched there too.
Let's get past this peak in sub-variant Omicron cases and then we'll have options.
Putting COVID behind us is a dream. We can't ignore it. What we need to focus on now is moving forward in a way that protects those that need most protection and allows society to continue.
Not focusing on those daily numbers and deaths, and it is a change, but it's always been where we've had to get to. There needs to be that certainty, that lack of this feeling like something that's hanging over us at all times, even though it is something that we're trying to live with. So I'm not surprised about that, but I guess it would be really frightening. I had COVID last week, and I think I'm about as healthy as I can be, and I went down like a sack of potatoes. Like I really was absolutely surprised by how hard it hit me. And I think when we're getting back into that normal life, it must be really terrifying for people who are not healthy or, have issues with their immune system or, people with a disability where it's not like they're feeling like they're going to be going in there fully fighting this thing because you just don't know how it's going to affect you. I've had similarly some people who have had absolutely nothing happen to them at all and they said, I didn't even realise I had it, I just tested positive. So it's a real lottery how it affects different people and you just can't tell what that's going to be for you.
Yeah, and I take your point about people who are immunosuppressed is well made. But I guess the one good thing is that we do know there are actually quite a lot of treatments as well that people like that can access if they're in touch with their specialists and so on. And that might be a good way to try to limit this because, as you say, we're only going in one direction here, unless a new variant changes everything, which could definitely happen. That's kind of the place that we're going to end up, whether we like it or not.
And is anyone else getting a sense of deja vu with the messaging that we're getting from the politicians, though, with the rules being different from state to state, territory to territory, and that it's like, oh, well, this is, and I'm like, it is really difficult for people to keep up with what the rules are.
Definitely.